Hello, and welcome to our presentation on hepatitis. We are excited to be able to present this information to you, and our group is made up of Teresa Custodio, Raquel Galucci, Alexandra Shekfun, Julie Smith, and Maribel Villegas. Enjoy!
Hepatitis is generally termed referring to inflammation of the liver. The severity of the disease depends on many factors, including specific causes of inflammation, as well as any pre-existing physical conditions. Hepatitis is most commonly caused by viruses and can also be caused by drugs, alcohol, chemicals, autoimmune, and metabolic diseases. Risk factors that contribute of acquiring hepatitis is normally transmitted through bodily fluids, blood products, blood, sexual contact, contaminated water and food, which can be uncooked or unwashed, things like that, and through sharing personal items that contain blood, such as toothbrushes or razors. According to Lewis, Dirksen, Heikemper, and Boucher, the pathophysiological cause of acute hepatitis is damage to the liver. This damage results from lysis of hepatic liver cells initiated by cytotoxic cytokines and natural killer cells. The hepatocytes have the ability to regenerate and repair themselves. Without any other problems, those liver cells can be restored to their proper function and appearance. In chronic hepatitis, inflammation results from long-term infection and can cause the hepatocytes to become fibrotic, leading to cirrhosis. Okay, so here we have 5 types of viral hepatitis. For example, hepatitis A and E. Both can only manifest in acute state. They are transmitted by fecal and oral route and are more prevalent in developing countries, especially hepatitis E. Source of infection may be acquired through poor personal hygiene, poor sanitation, and mainly contaminated food and water. Best measure of prevention is through hand washing. Hepatitis B mainly transmitted by exposure to blood and blood products. Incidence of Hep B has decreased due to available vaccinations. Hepatitis C is the most common type and can result in both acute and chronic forms. As well transmitted through blood and blood products, the use of needles and syringes are the main sources of transmission. Hepatitis D cannot be acquired by itself. It requires hepatitis B for replication. It can be acquired at the same time as hepatitis B, or the person with hepatitis B can be infected with hepatitis D at later time. Main thing to remember is that hepatitis A, B, and D does have available vaccinations.
Clinical manifestations of viral hepatitis can be classified into 2 phases of acute hepatitis and chronic hepatitis. With acute hepatitis, the manifestations generally last 1 to 4 months, where this is the period of maximal infectivity. Then with chronic hepatitis, the phase of manifestations generally lasts an average of 2 to 4 months. With acute hepatitis, many individuals may not experience symptoms, whereas others may experience intermittent or ongoing symptoms throughout. In the phase of chronic hepatitis, the clinical manifestations that can be exhibited are malaise, easy fatigability, hepatomegaly, myalgias and/or arthralgias, and elevated liver enzymes, specifically the AST and ALT. In the phase of acute hepatitis, the clinical manifestations that are often exhibited are decreased sense of smell and taste, which often contribute to the experience anorexia and weight loss, nausea, vomiting, right upper quadrant discomfort, constipation, diarrhea, light stools, malaise, arthralgias, headache, fatigue, fever, jaundice, urticaria, pruritus, hepatomegaly, which often continues with tenderness, splenomegaly, dark urine, and bilirubinuria.
Lab results used to diagnose hepatitis fall into 2 categories: antibody tests and liver function tests. Antibody test is the first way to diagnose a case of hepatitis, And of course, it will depend on what type of hepatitis your patient has. There are antibody tests for hepatitis A, B, C, D, and E. And in each case, the test will come back positive if your patient has had antibodies that were produced during a past or present infection. Also, in the case of hepatitis A and hepatitis B, if your patient has been immunized in the past against these illnesses, they will also have a positive result for the antibody test. There are also many liver function tests that can be used to determine whether or not a person has hepatitis. The first one is a bilirubin count, which in the case of a person with hepatitis will be elevated. Bilirubin is a byproduct of heme catabolism, and it is primarily produced in the liver, spleen, and bone marrow. Increased levels of bilirubin often occur in hepatic illnesses. The second is alanine aminotransferase test, which will also come back elevated in the case of hepatitis. ALT is an enzyme that is concentrated in liver cells, and elevated serum levels indicate liver damage. A third liver function test is aspartate aminotransferase, or AST. AST is an enzyme that exists in large quantities in the liver and myocardial cells. Elevated levels indicate liver damage. There are 4 other liver function tests that are commonly used to detect hepatitis. All of these tests will have abnormal results in the case of hepatitis because when the liver isn't functioning properly, certain proteins and enzymes are not processed the way or produced the way that they normally are. The first is alkaline phosphatase, or ALP. This test will come back elevated because ALP1 isoenzymes indicate the presence of liver disease. The GGT test, or glutamyl transpeptidase test, also will come back elevated because liver tissues contain large amounts of GGT and levels are elevated in all types of liver disease. Another test that will come back elevated is the International Normalized Ratio, or INR, and the prothrombin time, or PT test. So prothrombin is a protein produced in the liver, and when you get an abnormally high clotting time, it indicates that there are not enough of these proteins being made due to liver disease such as hepatitis. The last test is albumin, and the results for this test will come back decreased. And the reason for this is that albumin is a protein that transports hormone, heme, drugs, calcium, magnesium, and waste products. And it is also produced in the liver, and when you have a chronic liver disease, the levels will be decreased.
Although there is no specific therapy for hepatitis, it's recommended that you eat a well-balanced diet with vitamin supplements and rest to promote healing and liver regeneration. You also need to avoid alcohol and drugs metabolized by the liver. The healthcare team for hepatitis may include the primary care provider, a hepatologist, a gastroenterologist, an infectious disease physician, nurses, and a psychologist. Drug therapy for chronic HBV include nucleotide analogs and nucleoside, including tenofovir, talbivudine, adifovir, entecavir, and lamivudine. You also are going to have your standard interferon and pegylated interferon. Drug therapy for chronic HCV include protease inhibitors, ribavirin, and pegylated interferon.
There are several nursing diagnoses that closely apply to a person who has hepatitis. One is imbalanced nutrition, less than body requirements related to inability to intake or digest food due to anorexia, nausea, and vomiting. That is a common problem with people with hepatitis. Another is acute pain related to inflammation and swelling of the liver. Another one is fatigue related to chronic inflammatory processes, which happens with a lot of people with hepatitis. They become very fatigued. A fourth one is activity intolerance related to weakness and fatigue caused by infection, which is closely related to the one before, because people with hepatitis often are fatigued and have a really difficult time having energy to carry out their activities of daily living.
Potential complications of hepatitis include acute liver failure, cirrhosis of the liver, and hepatocellular carcinoma. To identify whether acute liver failure has developed, signs include jaundice, coagulation abnormalities, and encephalopathy, which include cerebral edema and decreased level of consciousness, confusion. Cirrhosis of the liver identification includes fatigue in the early stage, and jaundice, peripheral edema, ascites, skin lesions, hematologic disorders, endocrine disturbances, and peripheral neuropathies in the later stage. And identification of hepatocellular carcinoma includes enlarged liver, an enlarged spleen, jaundice, weight loss, peripheral edema, ascites, and portal hypertension. Prevention of possible complications primarily would be to prevent getting the hepatitis virus. To prevent hepatitis A, general measures include hand washing, proper personal hygiene, controlling proper handling of food, environment sanitation, the use of immune globulin measures include early administration to those who have been exposed within 1 to 2 weeks after exposure, prophylaxis for travelers to areas where hepatitis A is common if not vaccinated with the hepatitis A virus vaccine. To prevent hepatitis B and C, general measures include hand washing, avoiding sharing the toothbrush and razors, hepatitis B immunoglobulin administration for one-time exposure, and immunizations. Percutaneous transmission measures include being screened or screening the donated blood, and use of disposable needle and syringes, and to prevent the transmission through sexual activity, use condoms for sexual intercourse, and hepatitis B immunoglobulin administration to sexual partner of Hep B positive person, and vaccine as well. Prevention of possible complications continued. To help prevent acute liver failure, limit the intake of acetaminophen and alcohol consumption, which directly affect the liver and destroy the tissue, and detection and treatment of Hep B, which is the second most common cause of acute liver failure aside from drugs, such as acetaminophen. For cirrhosis, alcoholism must be treated and urged to be stopped or minimized, which will, for the sake the alcohol damages the liver. Adequate nutrition is essential for liver regeneration, and identification and treatment of acute hepatitis early to prevent chronic hepatitis and cirrhosis. Hepatocellular carcinoma prevention includes early identification of chronic Hep B and C, treatment of chronic alcohol ingestion, and screening using the AFP serum and CT, MRI, or ultrasound of the liver every 6 to 12 months, especially for those who are chronic alcohol users or have consumed high amounts of acetaminophen.